stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone, you're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH balanced cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta-hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment.
These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-1,000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies. Start with over-the-counter treatments. Use generic prescription medications if needed. Ask dermatologists about patient assistance programs for expensive medications. Consider community health center dermatology if cost is barrier. Check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines, and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments. Bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75, Acne in Specific Professions, Pilots, Surgeons, Healthcare Workers, and Others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60: Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding Acne in Specific Sports and Athletic Activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne lesions might be higher. Aggressive acne management is